Keep that in mind if you keep your camera on. All right, Steph, you want to move us to the next one? So we thought we'd start the evening off by showing some of the faces of the people that you all represent and support. This is just a collage of some of the activities at SBA and wonderful faces. And we wanted to make sure that we put them front and center in what we were talking about tonight. So we thought we'd start off with stories, and I'm going to turn it over to Mike so that he can share a couple to get us going.
Yeah, thanks, Sarah. As Sarah mentioned, I'm Mike Wood. I'm the Chief Operating Officer here at Spina Bifida Association. And we did want to kick this off by telling some stories of the people in our community, because at the end of the day, that is what all of this work is about. We make a really big point to make sure that the people that we serve are front and center in all the work we do. That famous saying, "Nothing about us without us," is something that we really live by. And so we wanted to tell some stories of the impact that, frankly, that you all have made possible through your contributions, which we really appreciate. Sarah's going to tell a few after the ones I want to share with you, but I do have a couple in particular that I want to highlight. So the first one, and some of you may have seen these because we shared these last year in the appeals that we sent out, so they may be familiar to some of you. But the first one is about Kelly and Larry Peterson and their daughter Hadley. Larry and Kelly were two individuals in our community, both of whom have spina bifida. And like many adults with spina bifida, they wanted to have a family. And in their case, they were looking to adopt. And because of a variety of reasons, frankly, for the most part, because of the fact that there's a stigma in the world about people with disabilities, they struggled to actually adopt someone. These were two people who are thriving, who are successful, who have all the love to give and the capacity to be parents. But time after time, they were told no, they couldn't adopt. Finally, they were able to adopt, and they chose to adopt Hadley, who also has spina bifida. And they were able to successfully adopt Hadley, and Hadley's thriving. They're doing a great job as parents. They've been very successful. I think both of them would tell you it's not always easy because of the challenges that they have. And on top of that, the challenges that Hadley have, but they're doing very well. And just as an aside, if any of you are interested in following this story, they've done a really great job of documenting this on Facebook. They have a Facebook group called Journey Down a Country Road. If you just put that in, Journey Down a Country Road and spina bifida, you'll find it. But it's Journey Down a Country Road, spina bifida plus adoption equals our family. So they really sort of tell their story. They talk about all the highs and lows. It's really a great page. But again, this is a family. This is just one example of the kind of people that the work that you're doing or the work that we're doing through your support is helping. Again, a couple of people who are fantastic members of our community. They have a great daughter. She's doing really well. She's adorable, as you all can see. But we wanted to make sure that we lifted up the hard work that they've done and just really celebrate everything that they've accomplished. So anyway, so that's Larry and Kelly and Hadley. I also want to tell another story, and then I want to sort of tie this back to some work that we're doing that you all have made possible. This story is about Anshul Varma, who is a member of our board, actually. So Anshul is an adult with spina bifida, and we wanted to highlight this story because it's just another example of someone who has spina bifida, who has been very successful, who's thriving as an adult, who contributes tremendously to the community. Um, he was an employee at KMPG. Um, he's been tremendously helpful to our movement, and he's a dad. And you know, as you can see from the slide, like a lot of people that we talk to in our community, he had a lot of apprehension about being a father. Because of the challenges that he faced, but he's been very successful as a father. He has a very close relationship with his daughter. She's doing incredibly well. She's actually, as a quick update, she's studying abroad right now. She's over in Denmark, and they, you know, I think the point of this story really is that it's not in spite of his spina bifida that they've done so well as a father-daughter unit, but really in many cases it's because of his spina bifida. It's really brought them much closer together. And so I wanted to tell these stories because there's a number of things that we're doing that frankly you all have made possible to help families like this. And so one of those is that we're just trying to lift up these stories and tell them in a much more visible way, because there is a ton of stigma out there about people with disabilities, people with spina bifida in particular. And we want to show the world that people with spina bifida can thrive. They can be highly successful. They're contributing to our community and to the betterment of our world every single day. Their fathers, their mothers, and they can do all the things that everyone else does. And that's not always sort of the story that's told. And so what happens is that that stigma sort of gets started at the beginning of this experience. And that's something else that we're very much trying to change. And it's something else that you all are contributing to helping change. So what typically happens is that when someone is diagnosed with spina bifida, they're basically told it's a death sentence. They're given a picture of the future that is very bleak. There's a lot of reasons for that. It's taught as a pediatric condition. How it's taught has not kept up with the advances. You know, 2/3 of the people in the spina bifida population are adults now, and they're doing very well. And that story's not getting told. And so that picture gets planted at the beginning at diagnosis. And as you can imagine, that impacts the way people are raised. And if you're raised with a sense of limitations, that's going to be sort of the way you face the world, as opposed to a sense of possibility. And so we're trying to change that, because what we see is that people with spina bifida can thrive and they can do all of these things. They can have families. They can be successful parents. They can hold down successful jobs. They can contribute tremendously to the community. And so we are actually creating a series of tools. We have created tools, and we're working on getting those out right now that would start to change that experience for people, that would start to change the diagnosis process. You all are making that possible. We feel like if we can change that diagnosis process and get people off to the right start, and people get a much more accurate picture of the possibilities of living with spina bifida, that people can come into the world with a sense of possibility, not a sense of limitations. And that's going to really put them on a fundamentally different trajectory. And anytime we hear these stories of people like Anshul, people like the Petersons who are thriving, they always tell us the same thing. And it's that they were raised with that sense of possibility. And so we want to make sure that that's the experience for everyone who's living with spina bifida. And again, it starts with the diagnosis process. The other point I would make here is that, particularly in the case of Anshul and Faith, is that we are very deliberately trying to bring families together, and then over time convert those individuals into being strong advocates for our community. And so this is also part of what you all are supporting with your resources, and I really appreciate it. But we're bringing people together in experiences like our walk and rolls, which are as much fundraisers as they are fundraisers. They're really community building experiences. And we're, by doing that, we're then working with people to convert them to become advocates for us so that we can grow the pool of advocates we have who are fighting for improvements in the healthcare system for people with spina bifida. So we can get beyond just people with spina bifida, but we can grow that pool of advocates to also include their families and their care partners and their friends. And you are all making that possible. So again, I thank you so much for that. So Sarah, I'll turn it back to you for a few more stories.
Sure. So I'd like to tell you a little bit about Colleen and Nate. So for those of you who know me, know that I've been around SBA for a little while, about 15 years now. Nate was a year old when I joined this organization, and he's getting ready to go to college. It's scary how that happens. But he is living a phenomenon right now that we call the care cliff. He is transitioning from pediatric healthcare to adult healthcare and finding that it's very difficult to get adult healthcare providers who know anything at all about spina bifida and caring for people who have it. And you add on top of that we've had a spate of losing adults over the past year for a variety of reasons, many of which are preventable through things like sepsis and infections. And it's really kind of scary for our families. And I think their story is the story that many teenagers and their families are living right now. I have one foot in the pediatric world, but I have one foot in the adult world. And the foot that's in the adult world is on shaky ground. You know, the basis that they've had in the pediatric clinics over the years has been something that's supportive and something that's nurturing and addresses care coordination. But what happens when people start transitioning to the adult side, they find a very disjointed healthcare system, one that really is not ready for our community. And that's something that your support is helping us to start address. And I'll tell you a little bit more about that as I kind of wrap up. I want to now talk about another story that's on the other side of transition. It's the healthcare provider who is working with these kids in the pediatric setting, who is terrified because she feels like she's sending children who are growing into adults into an abyss of healthcare. And she and her colleagues have spent years getting these kids the best care that they can have so that they can grow and they can thrive, and knowing that she's getting them ready for a side of the healthcare industry that's not prepared for them and their needs. And so that's one of the folks that we've been working with. Her name is Laura Hobart Porter. She's in Arkansas, and she's a physiatrist down there. And she just really feels like we should be able to mirror on the adult side what happens on the pediatric side. And her story is one that resonates with many physicians, some of whom are on this phone call. So anyway, one of the things that we're focused on at SBA is adult care, because 65% of the people in the United States who live with spina bifida are adults. Yet there are, roughly 130, it varies between 100 to 130 clinics that treat children, and about 30 that claim to treat adults. And so that's one of the things that we're very focused on. Another instance of another adult who I think mirrors a lot of frustrations that people within our community have is Monica. And Monica's story is one of a thriving individual, like Mike described with Angel and others, who has spina bifida. Monica is a nurse by training, and she was employed as a nurse. She's also a grandmother. She's a mother, and she's in her late 50s, almost 60 years old. And she needs access to something called transanal irrigation, which is a bowel management product that Medicare does not cover. And Monica, during her last job, was fired because she had a massive bowel accident while she was working, and the employer fired her. And so she was forced to go on Social Security disability to survive. And she did, and she still thrived through that. And she's been fighting to get TAI so she can get off disability and go back to work, and has not been able to do that. And we have been working very closely um, with a couple of companies, WellSpect and Coloplast, to try to get this covered by Medicare, because if Medicare will cover it, insurance companies will follow. It can become a product that many call life-changing when they're able to use it. And it works basically as part of your colon, so that it's almost as if you have a functioning colon again by using this product. And as a result, basically, people become more continent, and they're able to be much more regular in their bowel movements, which adds to less stress in their life and less anxiety, and perhaps the ability to become employed as well. So we're in a full-fledged plan working with the companies and with United Spinal Association to try to get this covered. And it's just an example of how the resource dollars, excuse me, excuse me, that you provide have been leveraged to be able to try to make a huge change for people who live with spina bifida. We couldn't do it without you. So those are just a few stories. And I wanted to tell you, before we go on to the financial story, I do want to wrap back to the adult piece, and to say that we know that without training physicians and making systemic changes, transition is going to continue to be the same way it is now, which is very disjointed and leads to nothing. And that's not okay for our community or for many other communities. We're not the only ones who are faced with this. That's why SBA formed a coalition of other organizations to start working on the issue of transition. We call it the National Partnership for Pediatric to Adult Care Transition, INPACT for short. We're working with the Hydrocephalus Association, Osteogenesis Imperfecta, and others to try to come up with strategies to address the systemic barriers that our populations face as they transition to adult health care. So we'll keep you posted on how that goes, but we're just at the beginning stages of that. And so now my job is to talk money with you. And we wanted to talk a little bit about the impact that you all bring to the organization. We are not a huge organization. We do a lot with a little bit of money, and we're able to do that thanks to the generosity of our donors and the generosity of our multitude of volunteers. We're a small, basically between $2 and $3 million organization. We get our money through pretty typical ways. We get it by doing events such as the walk and roll that Mike mentioned earlier. We get it through events like the World Congress and the clinical care meeting and other events. But we also get it through the generosity of donors in the corporate world. I mentioned Coloplast and WellSpect we've worked with, but we've worked with Smith and Nephew. We've worked with Hollister. We've worked with a lot of organizations to try to work on things that will have an impact for our community as well as for those companies. And that guides how we work with organizations like those. But to be honest with you, their generosity also helps us to fund a lot of other work that we do. And through individual giving, through donors such as yourself, major givers who give a larger portion of their disposable income to us than others. But we take from whomever, to be honest with you, because we need everyone. And it does make a huge difference in our ability to be able to move things quicker, faster, better, and longer. And then the final source is through grants. And that grant number seems high, and that's through a federal grant that we have received over the past several years. We're actually trying to make another form of grants go higher, those through private foundations. So that's something that we are working on now. So that's basically our funding streams in a nutshell. There are other smaller things, but they really provide much less of the pie than those major buckets. As far as our expenses, we really do a great job of keeping every dollar going to programs and services and very little going to management and overhead. And a lot of that's because our management actually does a lot of program. So we're able to do that. But those dollars given to us, you can rest assured that somewhere around 15 to 20% goes for the overhead, and the rest of it goes directly into programs and services and getting those done. You'll see that we spend our money on things that you would expect. Even though we do a lot of advocacy, we do it at a very low rate because most of our advocacy is done through the work of volunteers. So that doesn't cost us dollars. The dollars comes into play when it's developing the campaigns that go along with that. We also spend some money on our chapters and trying to keep those growing and moving and doing the work that they need to do at the local level. And we spend a little bit on our fundraising and development, you'll see. Not a lot. We don't spend a lot of money to try to raise money. Our view is we try to spend as much as we can on education, and we hope the education will lead to the development work. We spend money on education, a good chunk of money. We spend a lot of time on it as well. I think that the education series that we've started working this year has made a huge impact. We're seeing huge numbers who are attending those sessions and finding great value in them. I think in just a few sessions at the end of last year, we served almost 4,000 people, more than we ever served in any of all of our education days combined. So we spend a good bit on education. And then the other piece is research and clinical care, because that's where we think we can make a difference in the future for spina bifida and the caring of individuals who have it. And so we spend about a quarter of our money that is raised on research and clinical care. And Mike, I'll turn it over to you.
Okay. So I'm going to, we're going to pivot from finances and talk a little bit about some of the highlights of last year. And then looking forward, I'm going to sort of go over the strategic plan and what we're focusing on to advance that plan this year. So yeah, so last year was our 50th anniversary. And it was the 50th anniversary of the national organization. Some of the local spina bifida organizations that make up our network have actually been around longer than that. But it was, again, 50 years for us. And we made a point to try to highlight that throughout the year. And we had a very, very busy year last year. It's never not busy here, but there was a lot going on, and we accomplished a lot last year. Thanks to the again, thanks to your all's contributions. We could not, I can't say this enough, we literally couldn't do this without you. So just this slide sort of points out some of the bigger highlights of the year, and I'll go through those quickly. So one is around our clinic care partners. As Sarah mentioned, we spend a pretty significant amount of our resources on research and improving the state of research around spina bifida care. And part of the reason why we're doing that is, part of it's obvious, there are unanswered questions as it relates to improving the quality of life for people with spina bifida. And so we have a community-centered research agenda that we built with our community that we're trying to advance and find people to do the research around the questions that our community is telling us are important. But we're doing that because we have created clinical care guidelines. Those were created with the best thinking of the community, from clinicians and from people living with spina bifida and their care partners. but we want to make sure that they're informed by the latest research. And so we are advancing that research agenda to improve those standards. And then we leverage those standards through our clinic care partner program to try and raise and standardize the quality of care that people with spina bifida are receiving. So when you think about spina bifida care, we really look at it through three lenses. One is availability of care. The other one is affordability of care. Obviously, if it's available and you can't afford it, you can't access it. But the other is quality of care. So we want to make sure that it's available, it's affordable, and it's of high quality. And so part of the way we do that is through our clinic care partner program. We grew the program last year. We're up to 40 clinic care partners now and hoping to continue to grow that. There are about 100 pediatric spina bifida clinics around the country and only 30 adult clinics. There's not enough of either. We want to grow the number of those clinics, but we also want to bring people into this clinic care partner program so we can work with them more closely and we can standardize the quality of care across the country for people with spina bifida. Our walk and rolls, I mentioned those earlier. That's a program that's first and foremost a fundraiser for our organization. It's a peer-to-peer fundraising program. Lots of organizations have walks or similar events where they raise money, but we look at our event not just as a fundraiser, but as I mentioned, a friend raiser. It's a way for us to bring people into our community and strengthen the connections between people with spina bifida, their care partners, their family members, and a broader network of people who care about these issues. So it's as much an acquisition strategy for us as it is a fundraiser. Those programs, those walk and rolls around the country continue to grow. Last year, we had record numbers of participants, over 2,000 participants, and we had a record fundraising year. And we also had a record fundraising year before that. So we continue to break records in our fundraising and our participation rates for walk and rolls. And I'm hopeful, I don't want to jinx it, but I'm hopeful that will continue this year as well. Last year, we don't do this every year. We do it about every 4 years or so, 4 to 5 years. We do a Spina Bifida World Congress on research and care. It's a research conference where we bring researchers together, from not just the United States, but around the world to bring the latest, greatest thinking in spina bifida care into a community of like-minded individuals. Last year, we did this in Tucson, and it was the largest World Congress that we've ever had. We had at least 400 attendees. I think it was a little over 400. They represented 18 countries. It was an absolutely fantastic Congress. We hope to continue to grow that as the years go on. We haven't quite figured out when we're going to schedule the next one, but it will be sometime within the 3 to 5 year range. We, as also part of our work that we do at the Spina Bifida Association that you all make possible, we not only are trying to address sort of the systemic problems, the root causes of issues that people in our community are facing, but we also need to meet people where they are because people have immediate needs in the here and now. And so we do that primarily through our National Resource Center. We have a helpline. We have one person that manages this for the entire country. She was able to help over 200 people last year with case issues that they had. Those span the gamut from people who are looking for providers to people who are struggling with getting access to medical supplies. It runs the gamut. But we all, again, in addition to trying to solve people's systemic issues, we do try to meet people where they are and meet their immediate basic needs. And we do that through the National Resource Center. So we had a huge caseload last year for one person, but she did a great job. And, it's also a great way for us to stay connected to the everyday lived experiences that people in our community face. So that's the National Resource Center. We also had a ton of programming last year, probably the best year we've ever had for educational programming. As Sarah mentioned, we spend a huge amount of our budget on educational programming. We had over 4,000 people sign up for virtual programming last year. We used to do a lot more in-person programming, but what we're finding is that if we can do shorter programs, we can get much greater participation. And if we can offer it virtually, obviously, it lowers the barriers to entry for people. So we had a huge number of participants, and I think we're on track probably to break that record this year. Last year's Till on the Hill, that's our annual advocacy event where we bring people in the community together to advocate for funding for spina bifida care in the federal budget. And other issues that impacts the spina bifida community and the larger community of people with disabilities. Last year, we had people from 27 states who participated in that. We had 70 meetings with offices of members of Congress. We were able to maintain the funding for the spina bifida program, which in the political environment that we're in right now is a victory because many programs are getting cut. We were able to maintain our funding. And this year, we actually already had our Till on the Hill event for this year, and we far exceeded these numbers. So we had over 150 people register. It's the most number of people we've ever had sign up for Till on the Hill, and we had almost 100 meetings this year. So it was a hugely successful event, and again, you are making that possible with your donations, which we really appreciate. We had a program last year called Project Echo, which is a model of training that medical professionals go through. We built this, we used the ECHO model to build a training around spina bifida. We had 25 healthcare professionals go through that program. It was a fantastic program, but I think what's really interesting about it is that we learned a lot about sort of how spina bifida training needs to be structured for clinicians and for medical professionals. And so what we hope to do is leverage that training and the learning that we were able to obtain from that training to create a suite of tools and resources and more accessible training that we can deliver at scale to hopefully bring more people into treating people with spina bifida, because we obviously need to grow the number of care providers. Last thing that I'll mention is that, and this sort of goes back to some of the stories I told earlier in the conversation, we are trying to do more to support people from the time of diagnosis until the time that they're 3 months old and they're able to get access and get connected to a spina bifida clinic. Yes, Sarah mentioned we're spending a lot of time on transition to adulthood, but the other place we're spending a lot of time is on that early period. And one of the ways we're doing that, in addition to those diagnosis tools that I talked about that you all made possible to try to change that experience for parents, is that we are setting up an expectant parent network. That network is growing, but we were able to launch it last year after a ton of legwork was done to get it up and running. We had 7 mentors who were trained, and we're already connecting expectant parents into that network now so that they can get peer support and hopefully again, sort of transform the experience that new parents are having so that they can really see the full set of possibilities that their children are going to have as they transition into adulthood, because really the sky's the limit. So let's go to the next slide. So let me just mention a few points about where we're going. So we have a strategic plan. We call it a 3-year strategic plan, but I really think, and I think Sarah would agree with this, that it's probably a longer term plan than even 3 years. It's really focused on the changes that we want to see in the world as it relates to people with spina bifida. So here are some of the priorities for us this year and as we move forward. So the biggest one is that we need to close the care gaps that exist in clinical care for people with spina bifida. And those care gaps exist to the greatest extent for adults with spina bifida. As I mentioned, there are 100 pediatric spina bifida clinics around the country, but there are only 30 adult clinics. So I don't have to tell you that's a huge problem for people in our community. They get to 21, 22, 23, and then they fall off a care cliff because there's no one to coordinate their care. And so we are working on closing that care gap with a heavy focus on addressing the transition issues that Sarah talked about. We put together the coalition impact that she mentioned. We are working on, again, developing training based on what we learned from Project Echo. If we're able to secure funding, additional funding, we'd like to set up a mentor, sort of a clinician to clinician helpline, so that patients, when they go in to see a family care provider who may not know how to treat someone with spina bifida, they can essentially give that care provider a piece of paper that says, hey, here's a clinician that you can call if you need to do consults. We are working on securing additional funding right now that would allow us to examine different models of clinical care to figure out what's the right model or set of models that need to exist, so that we can start to map out what a transition infrastructure would look like in the country. And then we want to go after funding to support that. But a lot of the legwork that's going into all of that is work that you all supported. So that's the adult side of the lifespan. But as I mentioned, we're also working on the early part of the lifespan. And so we want to make sure that babies and families get off to the right start. And so our work around that is really going to be on two big things. One is getting those tools out to OBGYNs so that we can transform the diagnosis experience. We've developed the tools, but the name of the game over the coming months into next year is going to be getting those in the hands of the right people so that we can transform that experience. The other thing is building out this expectant parent network, because we want to make sure that parents who have received this diagnosis have other parents that they can talk to, and they can get access to them for resources and support. The third piece of our plan is really around strengthening and building the community of people with spina bifida and their care partners. We hear constantly that people in our community feel isolated. There are 166,000 people with spina bifida, but in a population of 350, 360 million, they're dispersed. And so oftentimes they feel very much alone, and it affects their mental health, which affects their physical health. And we want to change that experience for people. And so we're working very hard to build, leveraging technology, stronger networks of people with spina bifida and their care partners. We're doing it through on-the-ground events like Walk and Roll, but we're doing it virtually through support groups and networks like our parent network, our network of Hispanic Americans with spina bifida, our network of people who are parents and care providers. And so we're trying to do more to strengthen and build those networks so that they can support one another and we can also learn from them. There are two strategies, as you can see on this slide, that I think of them as cross-cutting. We lifted them up because there are two strategies that support our three big areas that we're focused on, but they're sort of goals in and of themselves because they're just such substantial parts of the work that we're doing that you all are supporting. So one is making sure that we have better evidence and data. There are huge data gaps in the spina bifida community. There's a spina bifida patient registry that the CDC manages. That's part of the funding that we advocate for every year through the federal government. It's very important that we maintain that registry, but that registry needs to grow. There are 20-some clinics that are participating in the registry and about 11,000 patients whose healthcare data are in that registry right now. And that's just a small number, and we need more patients and we need more data in that registry. And we also want to build what's called a patient-reported outcomes registry, where the Spina Bifida Association would control the data and patients would actually report their own healthcare outcomes. There are lots of patient-reported outcomes registries out there. We're looking at different models right now and pulling together a work group to help us build that out. But that's the kind of work that you all are supporting. The future of healthcare research, I'm sure some of you are aware of this, but the future of healthcare research is really in taking healthcare data and using technology to mine it to help answer questions and also raise questions that you're not thinking about that would emerge from the data. And so we have to have more data and access to that data. And your all's funding is making that possible. And so I really appreciate that. The other piece of this is that we just have to raise awareness of the challenges that people with spina bifida are facing. That's part of the reason why we are lifting up these stories. Yes, we use these stories to raise money, but it's a huge part of our public education campaign, because not only are people in our community who know about spina bifida getting those letters, but we're sending them out to people across the country that we've never talked to before. Because we want to raise awareness of the challenge that people are facing, and we want to eliminate some of these stigmas, or at least reduce some of these stigmas that are out there about the kind of limitations that people with spina bifida have, because they're just not true. We are also working on focusing on policymakers. There's a huge knowledge gap in the policymaker space about the challenges that people with spina bifida are facing. And so events like Teal on the Hill, yes, they're about making sure that we continue the funding for the programs that we care about, but we just want to do more to educate policymakers and people who are in positions of power and authority on the challenges that people are facing. And so it's another way that your funding is helping to advance this agenda and change lives in a fundamental way.
So now is an opportunity to ask us some questions. So if folks would mind turning their mics off, or on, I should say, and maybe turning their cameras on, then we're happy to answer some questions. We put a few questions up there, but sky's the limit. Here's your chance.
Yeah, we'd love to hear from you. I know one person submitted a question about the strategic plan, and I hope I was able to address that. The last slide was really is a summary of our strategic plan. We have some goals that are much more internal, and they're not really interesting to people that don't work inside our organization on a daily basis. But in terms of what we're trying to do to change lives, that's the work.
Well, Mike, I guess we did a good job of explaining things.
Yeah, maybe we did. But yeah, these are some questions that, if you all don't have any specific questions, these were questions that we certainly were interested in hearing from you about. So I know when Sarah and I were talking about this and putting this together, the first question was really the most obvious one. We tried to lay out sort of a picture of some of the accomplishments that you all made possible, but also the work that we're trying to drive over the next few years. Just based on what you've seen, does it sound like we're working on the right things? Are there areas that you think we need to focus on that you didn't hear in this presentation? I'd really be curious to know what you sort of think about where we're headed. Don't everyone jump in at once.
Hey, Mike, John Wiener here.
Oh, hey, John.
I understand you had a successful Teal on the Hill a few weeks ago. I was unable to make it. Tell me how that went, and tell me what's going on with funding from grants from CDC, Centers for Disease Control and Prevention.
Yeah. So it was hugely. You never know until you see what comes out in the appropriations bills, how successful you were. But as far as an event goes, it was highly successful. We got really high remarks in the evaluations on the event. We had 150 people that registered. We had close to 100 meetings. I think it was maybe 94 or so meetings. That's by far the most meetings we have ever had. We covered 35 states. We covered a vast majority of House members and Senate members who are part of the Appropriations Committee, but also in each committee, for those that don't eat, sleep, and breathe this every day, there are subcommittees. And on the appropriations committees in both houses, there is a labor, HHS, Health and Human Services subcommittee, and that's the subcommittee that really controls funding of the CDC and funding of the spina bifida program. And this program at the CDC only gets $7.5 million a year, which I don't have to tell you all, it's a rounding error in the federal budget, but it's hugely important for our community. It is the only program in the federal government that's specifically focused on the quality of life of people living with spina bifida. There's funding in NIH around what causes spina bifida and how you can prevent it and so forth. But in terms of actually addressing the quality of life for people living with spina bifida, this program is it. We got a ton of positive feedback from most of the offices. There were very few meetings that people said were sort of ho hum. The support was bicameral. It was bipartisan. We've had people reach out to us, offices reach out to us since that meeting, saying that they would sign on to a letter, what's called a Dear Colleague letter that gets circulated in the chambers supporting our funding. Another thing that came out of this actually is that we had a member, Representative Chris Smith from New Jersey, who came back to us and said they were going to relaunch the Spina Bifida Caucus. That caucus had gone dormant, but they want to bring it back, which I think will be really helpful for us. So it was very positive. I know that the president's budget came out, and it does include the $7.5 million for the Spina Bifida program. So that's good. I mean, we want to increase the funding. We definitely don't want the funding cut. Given the tone of Congress and the challenges with the budget and the push to cut funding, if we're able to maintain the funding, we'll definitely consider that a success, but we really do need to grow it. We're going to continue to push to grow it. But I don't know, Sarah, if you want to add anything. I feel pretty optimistic that we're going to keep the funding. And we're going to continue to follow the process through until we actually see the numbers in the document.
I think it was a huge success just to be level funded in the president's budget. Actually the center itself, not just our programs, the entire center was level funded. So that's great news, because oftentimes that center gets cut. And when that happens, even the Congress would to say, yes, you get the same funding, if the center gets cut, ultimately we're going to get cut. So, those two things bode well for us. And I think what we did on Till on the Hill will bode well for us in Congress too, because we do have support of both houses. Both parties in both of the houses. So I think that does bode well for us, I think.
Yeah.
So I kind of breathed a sigh of relief when I saw the president's budget.
Yeah. And, I would say, I think, Sarah, you mentioned this earlier, a big chunk of our budget does come from grants, and that's mostly the CDC grant right now. We're trying to diversify the grants that we receive, but also it's never, we both feel this way, it's never a good idea to have that much funding from one source. There are no guarantees in the federal government. And so that's also part of the reason why expanding our donor pool and the support that you all provide is critically important, because we really do need to diversify beyond that. It'll create much more stability for the organization and the causes that we believe in and the causes that you all believe in. If we're able to, we definitely want that funding, but we would love to get to a place where it's not such a huge chunk of our budget. I think that's really important.
So, and I see, switching gears here a little bit, I see we got a question about the Expectant Parent Network, if we could expand a little bit more about that.
Sure. Do you want me to talk about it?
Sure.
Yeah. So that is Colleen Payne, who contracts with us, who's we mentioned you actually leveraged her story for one of our appeals, and Sarah talked about her. She, in addition to being a parent, she's just incredibly knowledgeable about all things spina bifida, and this is something that she's really passionate about. And so she has really been working behind the scenes to build out this parent network. And she's developed a training so that if parents want to be part of that program and they want to mentor expectant parents, they can go through this training and then they can be part of the mentor program. We just launched it last year, so it's still relatively nascent, but we're starting to grow it, and get information out to as many people as we can about it. It's again, it's just another way for us to to support expectant parents who've received the diagnosis of spina bifida, and are looking for support. My son doesn't have spina bifida. He's autistic, and I can just tell you, as someone who had a child with with a disability, um, you get resources from doctors, but the number one thing you want at that point in your life is you just want to talk to other parents and find out what they did for X, Y, or Z. And so I don't think it's any different from what we've seen with people dealing with any kind of disability. And it's certainly the case with people in our community, because they've told us that this is something that they want, or, in many cases, what they said to us is that it's something they wish they had had at the time that they went through the diagnosis and before their child was born. So we wanted to create that to make sure that parents, had that resource. It's always a
think it
challenge to
also,
find expectant parents. Oh, sorry, there's one more point. I think it's always a challenge to find expectant parents, because because of medical privacy. It's not like, doctors and hospitals can give us those names. But we're doing everything we can to try to advertise that, and spread the word about it so that they can find us.
and it grew out of something that was happening with the resource center, because when newly diagnosed parents would get that diagnosis and they're the deer in the headlight phase, trying to figure out what life might be like, we'd get a lot of telephone calls to the resource center asking if they could talk with somebody who
Right.
had been through the experience. And so Juanita spent a lot of time early on just finding individuals who would be willing to share their story, and kind of have that conversation. And so it grew from that into, let's create a program where we actually train people so we know what they're saying to them is not going to be something that they shouldn't be saying, number one. And number two, that they can really be that support piece and understand what that role is. It's not to tell people what to do, but to be supportive. And so I think that's where the ideas started germinating. And it took a volunteer like Colleen to come in and kind of put the structure around it and to develop the training. We couldn't have done it without her, to be honest.
Yeah. And again, it goes back to the point I was making earlier about how we sort of change the experience for people. If you go into an experience, and when we hear this from parents all the time, when they go into an experience where their child is diagnosed with spina bifida, the child that they're pregnant with, if the experience is bad, if they're basically told it's a death sentence, they're not going to have any quality of life, they're going to struggle. We hear stories all the time about how that creates trauma for the parents, and it impacts the way they parent the child. And what we really want to do is we want to shift that whole paradigm so that they're actually given accurate information about the possibilities for people with spina bifida as they mature and they grow and they become adults. Because if you are going through an experience where you're looking at your child from a perspective of possibilities versus limits, that's going to change the way you parent. It's going to change the experience. It's going to change the experience and the mindset of your child. So all of these things, Sarah, I think you talk about this more eloquently than I do, but all of these things are connected.
Yeah. We start off the diagnosis with trauma, and it just builds throughout their entire lifetime. And it's no wonder that anxiety runs rampant within our community, and depression. And so we're trying to stop it from starting, is really what we're trying to do. Is
Right.
let's
It's
go
all
back to
based
the
on false
beginning and see if we
information.
can make it better. So
Yeah, that's fantastic. As a physician, I saw a patient yesterday who was going home 5 weeks after they were born with spina bifida, and mother was a school teacher, and she's just so thirsty for learning more about spina bifida. And I always send them to the website, and I think it's just a fantastic resource and makes them feel like they're not alone.
Yeah. That's really what we try to do. Give people community.
And you know, again, you may be tired of me saying this, but yeah, some of the funding we get from the CDC helps with some of this, particularly the research work. But things like these tools that we're trying to get out, building training, all of the education that we do of people in our community, that's the work that you all fund. That's the work that we're able to do because of the donations that you all provide. And that's the work we really want to expand, so we can get beyond, you know, again, having so much funding from a single source. So I've said it several times, but I'm going to keep saying it. I just can't thank you enough. I've worked in many nonprofits over the years, some big ones, some small ones, all doing really good work. This is the best organization I've worked for in terms of having a positive impact on people's lives and literally changing people's lives. It's not an exaggeration to say that the support that you all providing has saved people's lives. And I hope you feel really good about that. I certainly thank you for it.
Well, we thank you for your time tonight. We're right at the hour and we're trying to honor your time. We want to honor your commitment that you made to us too and say thank you for the support you've provided. We want to thank our Blue and Teal Society, our major donors, and our recurring donors, our Backbone Alliance, and some people who fall in both of those categories, and our corporate sponsors as well too. We, you know, AbbVie, Attendus, Byram, Hollister, Shriners, Wellspect, Smith and Nephew, Rayos, Phoenix Children's Memorial Harmon, DMG Children's Rehabilitative Services, Convatec, Coloplast, and Comfort Medical supported us last year. We want to say thank you very much to them. Thank you to you all for your time tonight and for your generosity. We appreciate it. We hope the work we're doing is something that you find comfort in. How about that? All right. We'll say good night and say thank you, and we'll see you again.